Hi students, it's Dr. Pratheepa for the tomorrow's integrated teaching. I am just giving a brief summary about the prostate. First, before we into the details of the prostate, we will see how the structures are entering into the prostate. Everybody knows about the testis. Testis we have completed, and epididymis also we have completed. From the epididymis, the male genital tract, that vast difference it goes to the posterior part of the prostate. This is the structure called prostate, and here you have a separate structure, leaf-like structure, that is called seminal vesicle. Both this is the urinary bladder and this is the prostate. So these two structures, they join together and forms the ejaculatory duct, and the ejaculatory duct opens into the structure which is present inside the prostate. This is the prostate. The pale pink is the prostate. Inside the prostate you have a urethra called prostatic urethra. So it goes and opens into the prostatic urethra. So prostate also secretes a fluid, prostatic fluid. Okay, this 25%. Then next to this bulbourethral gland, this also secretes some fluid. So this is the urethra. This urethra next to the prostatic urethra, it is called the membranous urethra, and this is called the spinal urethra. So this is how the male urethra is formed. Next slide. This is about the pelvis. Okay, where the prostate is situated. If you see this is a bony pelvis. This outer part is called as false pelvis, and this inner portion is called as true pelvis. This is called greater pelvis, and this is called lesser pelvis. So inside the lesser pelvis only all your pelvic organs are situated. For example, urinary bladder, prostate, rectum, uterus and vagina, everything is situated inside the lesser pelvis. So the first thing is site. So site is present in the lesser pelvis. So what is present anteriorly? Anteriorly you have the pubic symphysis. So posteriorly you will be having the important structures in male is, first one is urinary bladder, next comes your rectum. In females, first is your urinary bladder, next comes your uterus, then only you have the rectum. So for us prostate, we are discussing about the prostate, so we should discuss only about the urinary bladder. Behind that you will be having the rectum. Behind the urinary bladder, what are the structures are present, we will see. And then the prostate, see, look at this picture. Here I can show, you can see the pubic symphysis. Just behind the pubic symphysis you have the urinary bladder. You can see the urinary bladder clearly here. And in the lower part, the neck of the urinary bladder, you have the prostate. In the prostate, the center part of the prostate, you have the prostatic urethra. So this is how it is located. So it is pyramidal in shape. If you have a pyramid, then definitely the pyramid should have a base and the apex. So the base will be situated up and the apex is situated down, so inferiorly. So and anterior posterior portions we will see. So first, this is about the bony pelvis. Already I showed you. The bony pelvis is opened, and anteriorly the green color signifies that here this is closed by a diaphragm. Diaphragm is a part which separates. In thorax and abdomen are separated by the muscular diaphragm, and here also it is separated. This area means inside pelvic cavity is there, outside the genital areas are there. So these two structures are separated by a diaphragm like structure called urogenital diaphragm. Like that, the inferior portion means the bottom of the lesser pelvis. The lower part of the lesser pelvis is separated from the outer part of buttock by a diaphragm called as pelvic diaphragm. So these two diaphragm are very important in the pelvic region. So this is urogenital diaphragm, and if you see here, this is the pubic symphysis. Behind the pubic symphysis you have the urinary bladder. Between the pubic symphysis and the urinary bladder there is a space just behind the pubic symphysis. So it is called behind. So it is called retropubic space. This space is very important for MCQ purpose, viva as well as for theory. So they will ask you what is the space behind the pubis. That is called retropubic space of Ritzius. What is the clinical significance of that space? So this importance is behind that this space only. Bladder is a smooth viscera, and this is a bone. So whenever the bladder is getting enlarged, it definitely it must have got some friction. To prevent the friction, here we have a fat. So retroperitoneal pad of fat is situated, number one. Number two, to keep the bladder in position, prostate in position, we have ligaments going from the pubis. So it is called as pubovesical ligament and puboprostatic ligament. So two ligaments are here. So behind that, in the pubic space, you have the fat and two ligaments, pubovesical and puboprostatic ligament. Number three is vesicle venous plexus. Vesicle means bladder. So vesicle venous plexus and prostatic venous plexus. Two venous plexus are here. So the prostatic venous plexus is connected with the vesicle venous plexus, and posteriorly you have your vertebra. This is called sacral vertebra. So sacral vertebra going up is lumbar vertebra. So up you have lumbar vertebra. So this venous plexus, prostatic venous plexus, will be communicated behind with the lumbar venous plexus, that is called as the vertebral venous plexus, that is called as Batson's venous plexus. So the contents are: number 1 is fat, number 2 is puboprostatic and pubovesical ligament, number 3 is vesical venous plexus and the prostatic venous plexus. I'll go to the next slide. And this is about the apex and the base. You can see clearly. I will show you. This is the apex. Apex is lying in which diaphragm? I have showed this in green color, right? So this is the apex is placed in the urogenital diaphragm, and the base is placed in the neck of the bladder. So you can see clearly, this is the bladder, this is the neck of the bladder. So this is the base and this is the apex. Apex is situated in the urogenital diaphragm. This is a cross section and this is the main view. And then anteriorly it is convex. Already I have told you. Anteriorly it is what is present. We saw the space of reticulus, pubic symphysis, everything. So the same thing it's present here. Arch of pubis and space of reticulus, adipose tissue, puboprostatic ligaments, and this anterior part is deficit in glandular tissue, that I will discuss later. And next is posterior. Posteriorly, what do you have? This is the schematic picture and this is the original picture. In the original picture, if you see, you can see some structure which is leaf-like and lobulated. This is seminal vesicle, and the other one is vas deferens. The vas deferens and seminal vesicle, they join. This is just behind the bladder. These two, they join together and forms the ejaculator duct. This ejaculator duct opens into the prostatic urethra. Already I have showed you. See, look at this. These two structures, they join together and forms the ejaculator duct. This ejaculator duct opens into the prostatic urethra. So this is present posteriorly. Behind this only you have the rectum. And rectum, what else you have? So when you do the rectal examination, when you put your finger inside the rectum, you can palpate the prostate, posterior part of the prostate. So rectum, you have a one fascia is there, that is called prerectal fascia, that is called as Denon-Willis fascia, which is present here. Denon-Willis fascia. This is the space called rectovesical space. This is the space. Okay, rectovesical we have already seen the peritoneum. Okay, so this is about the posterior part. And then inferiorly, I have already told you, this bottom of the lesser pelvis is covered by so many muscles, that is called as pelvic diaphragm. Main important muscle in the pelvic diaphragm is levator ani. Okay, this forms a pubourethral sling or pubourethra, because prostatic urethra only it is coming through the prostate, right? So it is called pubourethral sling. Okay, that word is very important, and the muscle is levator ani. This next week we'll be having this class called pelvic diaphragm. That time we'll discuss in detail. Now you should know there is something called as pelvic diaphragm. The most important muscle in the pelvic diaphragm is levator ani. This levator ani forms a pubourethral sling. And then last, the most important one which carries most of the marks is prostatic urethra interior part. So when you open the prostatic urethra, you could see a linear crest. This is called urethral crest, linear crest. It is called urethral crest. In the middle of the urethral crest, you have an enlargement that is called as seminal colliculus or vermontanum. Okay, this. So number 1 is urethral crest. Number 2 is seminal colliculus. On the summit of the seminal colliculus, it means where the seminal colliculus is maximum enlarged, that area you will be having the opening called prostatic utricle. This prostatic utricle is nothing but the male homologue of the uterus and vagina. In females you have uterus and vagina, but in males we don't have that. Instead of having uterus and vagina, you will be having this prostatic utricle. This is very important MCQ. And then next is both the sides of the prostatic utricle, the opening of the ejaculator duct is situated, and both the sides of the urethral crest and the vermontanum, you have the prostatic sinuses are opening here. Prostatic sinuses, they open here. Inside the prostate we have lot of prostatic sinuses, they all open here. Okay, so number 1 is urethral crest, number 2 is seminal colliculus, number 3 is prostatic utricle, number 4 is ejaculator duct, number 5 is prostatic sinuses. These all are important. This carries the most important marks in the essay prostate. And then last, about the structure of the prostate. When you see the structure of the prostate, the outer covering of the prostate is called capsule, and inside you will be having the fibromuscular stroma, and inside that prostate is a gland. It secretes fluid, so you have glandular contents. So number one is prostate. Prostate own condensation, the prostatic tissue itself, it forms a true capsule around surrounds the prostate. So this blue color indicates prostate. The own condensation is called true capsule. Outside, inside the pelvic cavity, it is situated, right? So pelvic cavity is lined by pelvic fascia, so that forms the false capsule. So between the true and false capsule only, you will be having the venous plexus, that is prostatic venous plexus. It is situated between these two. So the clinical importance will be explained by the clinician, okay, the surgeon. Because prostate, when we remove the prostate, the venous plexus should not be disturbed. If you disturb, the severe bleeding will be there. So when you evacuate the prostate, you should not disturb this true capsule also. When you disturb the true capsule, this all will also be disturbed. So you should not disturb neither the true nor the false capsule. So the prostate has to be enucleated like a scoop, ice cream scoop. So just through the urethra they will go, and then they scoop it out and come back without disturbing these two capsules. Understood? This is called enucleation, prostate enucleation. If there is any tumor of the prostate, through that venous plexus, the prostatic cancerous tissue will go to this venous plexus. Through this venous plexus, it may go to the vesicle venous plexus or may go to the Bat's venous plexus, that is called vertebra. It is vertebral venous plexus. Already I have explained the communication between the prostatic venous plexus and the vertebral venous plexus. So this cancerous tissue, if it goes to the vertebra, that is called as metastasis. The bony metastasis. Metastasis means stage 4 cancer. The cancer is present here. It will be going towards the vertebra. So all the vertebra will be collapsed. The patient will be having severe pain, back pain. And then this is the fibromuscular stroma. Fibro means collagen fiber. Muscle means muscle, smooth muscle. Okay, so this is about the fibromuscular stroma, and this most important area we have come across is the glandular tissue. You have 5 anatomical lobes and 3 zones. These 3 zones are very important. There's maximum you will be having the peripheral zone. I will show you the zones. First let me talk about the lobes. If you take this model as a prostate, if you see this is pyramidal in shape, this is the base, and this is called the apex. And if you see this, I have put the urethra. This is the urethra. Okay, urethra is passed inside the prostatic gland. So anterior part of the urethra, you have anterior portion. This is called anterior lobe, and this is called posterior lobe. So anterior, posterior, and both the sides here I have put a probe here. This is the ejaculatory duct of this side, and this side you will be having one more ejaculatory duct here. It fell down. So 2 ejaculatory duct, it opens into the prostatic urethra. Inside it is going into the prostatic urethra. So first is anterior and posterior lobe, and the third one is just above this ejaculatory duct opening. You have a lobe called median lobe. Understood? So between the anterior and posterior lobe, just above the ejaculatory duct, this is the third lobe called median lobe, and the fourth one is both the sides. This 2 areas you will be having below the ejaculatory duct, that is called as lateral lobe. So again I repeat, number 1, in front of the urethra. Urethra is passing through this only. Okay, next to that only it is entering into the penis. So this is prostatic urethra which is going inside. So anteriorly brown color indicates the anterior lobe. Posteriorly it indicates red color indicates the posterior lobe. And both sides the urethral ejaculatory duct opening is there. So above the ejaculatory duct it is called as median lobe. Below it is called as lateral lobe. So totally you have 5 lobes. So now here I have given clearly as anterior lobe. You can see the urethra, prostatic urethra is here. Okay, in front of the prostatic urethra, full of fibrous and muscular, isn't it? Yeah, brown color I have given. So it is called as anterior lobe, which is devoid of the glandular tissue. No glandular tissue, full of fibromuscular stroma, least number of quantity of glandular tissue. So this is one. And then posteriorly you have all the lobes are present posterior only. Just behind the urethra, near the urethra, you could see the median lobe, and just behind below the, can you see this? Posteriorly only. So just behind, in front of the posterior lobe, you will be having the median lobe, because the median lobe is very important clinically, because it can compress. If it is enlarged, it can compress the prostatic urethra, which will reduce the flow of the urine. And then both the sides below the ejaculatory ducts you will be having the lateral lobes, and behind you have the posterior lobe. All other lobes are rich in glandular tissue. and you can see the median lobe which is projected inside the trigone of the bladder. Okay, this is very important. This is called as uvula of the prostate. Okay, uvula. This is the MCQ. Which lobe projects into the bladder? That is median lobe, which may compress the, which if it is enlarged, if it may compress the prostatic urethra and reduce the passage of the urine. And then here if you see the zones, 3 zones. I have already told you the outer one is called the peripheral zone and central zone, and then near the urethra it is called as transitional zone. Okay, transitional zone MCQ, it surrounds the prostatic urethra, just surrounds the prostatic urethra. Which surrounds the ejaculatory duct is the central zone. So MCQ number 1 is which surrounds the prostatic urethra is transition zone, and which surrounds the ejaculatory duct is the central zone. Outer one, 70%, that is called the peripheral zone. So peripheral zone means it indicates the posterior and other lobes. So this zone is more prone for cancer. This zone is more prone for benign prostatic hypertrophy. And here I have given the peripheral zone, central zone and the transitional zone. Peripheral zone, here we have given it encloses, already I have told you, it encloses the outermost part, and the central zone which surrounds the ejaculatory duct, and the proximal transition zone which surrounds the prostatic urethra. That is more important. And blood supply, since it is lying below the bladder, the inferior portion of the bladder, so the same artery will be supplying here. So inferior vesicle artery, and the prostate, behind the prostate the posterior relation is rectum, so middle rectal artery also supplies, and down that area is called as pudendal. The lower down area in the pelvic cavity is called pudendal. So internal pudendal vessels also supply. So 3 arteries. Number 1 is inferior vesicle, not the superior vesicle. Number 2 is middle rectal, because rectum is present posteriorly, and down one is internal pudendal artery. 3 arteries. And then venous drainage, already so many times I have explained. Prostatic venous plexus, it communicates with the vesical venous plexus and the vertebral venous plexus, that's all. And then nerve supply, here also we have written the same thing. The prostatic venous plexus is valveless, that's why the carcinoma, everything is going back. The vertebral venous plexus is Batson's. And then it goes to the lymphatic drainage, goes to the internal iliac nodes, and nerve supply is pelvis, no, it is present in the pelvis. So pelvic flanking nerves and inferior hypogastric plexus. And this is the dissection plane, how they do the dissection. Thank you.